I fell in love with the program. We say we're a family.
This residency is just amazing. Fit a lot of things that I was looking for.
It had that personal feel that I wanted in a very cool area.
I think that this place and this program has all of the things that I required in order to really be happy.
I'm Dr. Michael Bernstein. I'm the chairman of the Department of Surgery here at Staten Island University Hospital. We are very energetic in training our surgical residents. We're very proud of the program that we have here. We have 3 categorical residents per year, and we do have a component of preliminary residents in our first and second year. Our residents all graduate with over 1,000 cases.
Staten Island University Hospital serves the entirety of Staten Island. This hospital is a level 1 trauma center. It serves a huge population of people. The amount of volume that we get here, you see a lot of different pathology.
And Staten Island has a very diverse population.
People from all levels of socioeconomic backgrounds, from all ethnicities.
That makes for a better training experience. It makes you comfortable with a wider variety of things.
We have every component of general surgery that exists.
Bread and butter general surgery, we have exposure to vascular, plastics, minimally invasive, colorectal, and surgical oncology. And this is all in-house at the one institution that we are at.
We operate on everything here. The only outside rotation we have here is transplant. Everything else we're able to do here, from cardiacs, pediatrics, and we get to see literally every single thing that you could want from any institution.
We have a very strong robotic surgical program, and our residents get to experience the robot on a daily basis. And we're a center of excellence for bariatric surgery.
When I looked around for programs, I wanted somewhere that sort of a smaller community vibe, but also still offered really great resources and operative experience.
I wanted to go to a place where I could be a true surgical resident, meaning I would have exposure to lots of different types of surgeries. At the same time, I wanted the combination of having academics involved.
Northwell is like the largest healthcare organization in New York.
No matter what fellowship anyone wants to go into, there is a lot of research opportunities. I've been able to present at multiple national and international conferences and have had papers published in many journals. Really any opportunities for research you want.
Here at Staten Island University Hospital Surgery Department, we have great relationships with the faculty. And they're always a phone call away or just a text message away. You could always bounce ideas off them.
I think I've never felt so comfortable texting attendings or calling them in the middle of the night. I can ask them whenever. There's really no barrier between you and an attending, even as an intern. It makes the learning environment a lot more comfortable and a lot more productive.
The level of teaching here is something that I've never seen before in other hospitals. Faculty at our hospital is phenomenal. And so the attendings here are always willing to teach and take time out of their own ridiculously busy schedule to teach us. And I've been learning a lot.
That is a hallmark of this institution, that attendings will come in and will help and will guide. And that's something that's really affected how I plan to be as a surgeon, is to be willing to be there for the young junior residents who are just learning.
We're granted a lot of autonomy as residents to manage the patients, to work up the patients. When you become more of a senior resident, the attendings allow you to help the junior residents through cases under their supervision.
One of the strongest parts of this program is the early and frequent exposure to the operating room. On the first day, I think I was in the operating room.
I was blown away by the operative experience. Residents, attendings, and everyone else is all very, very supportive.
We all come from very different backgrounds, from all over the country, even all over the world. We all get along very well. We hang out outside of work all the time.
The people that I work with, they're amazing people. They're extremely friendly and very helpful. And so it just makes a great environment to work in.
I think we have a very good work-life balance.
We have a lot of organized social activities as well as completely organic ones. Once a month where we go out, we get drinks, and we just, spend some time decompressing from the hospital.
That's something that you won't see at most programs, that when we leave here, we're going to be friends for the rest of our lives.
This is the place that I have chosen to make my home for 5 years. It's the people and the physical location.
The benefit of living in Staten Island is great.
If you just look out the window, you see a fantastic view. There's great pizza, great food.
You have the beach, which is right down the street. The city is only about 45 minutes away on an express bus, or you could take the ferry. So you're basically in the city, but you're in a little suburb area, so it's a great place to live, to have a family.
This Community loves Staten Island University Hospital. You come here and people are born in this hospital, their whole family members have been treated at this hospital. That's not something you get everywhere.
These are people that we see in the grocery store. We see them out in the movie theaters. We see them everywhere. They are part of our extended family. And we give them first-rate care because we know these people, because they're our neighbors.
I was actually born in this hospital. I've had multiple surgeries in this hospital. And just growing up in Staten Island, it was a dream of mine to come here and one day be a doctor at this hospital.
I've been devoted to working with residents my entire life. It's really been the most fulfilling aspect of what I do. It's something that I'm highly committed to. We're a very homey program. We get to become a family to prepare them to be the surgeons that they'd like to be.
In terms of the advice that I would give to incoming surgical residents who are looking for programs, the most important thing is, these are the people that you're going to be working with day after day for the next 5 to 7 years. You need to go to some place where you feel like you can call the chief at midnight if there's a problem.
Find a place where you feel like the people are going to make you better.
When I look back at the beginning of first year compared to how I am now, I feel like a big sense of accomplishment because I feel like I've grown a lot as a person, but also I've just grown a lot as a healthcare provider.
I really find we're able to make a difference in all of our patients' lives, and our patients are so appreciative of it.
You'll also be able to train with people who will inspire you, teach you, and I think that's something that I want to do also moving forward.
You have to be dedicated to providing the highest quality care you can provide to every patient on every opportunity. And that's something that I try to instill in the residents on a continual basis.
Here it's very warm and you feel like everyone here wants you to succeed and become the best surgeon that you can.
It's the best program out there.
And I knew that there was nowhere else I would want to be.